When? Will doctors learn to report imaging results correctly? Most of the time, it is just frustrating, but in some instances, it can be dangerous if they do not get it right. To explain what I mean, let me share my Aunt Kay's experience with her breast cancer diagnosis. My aunt felt a lump in her right breast a few years ago. Having had surgery to her left breast previously, she was very quick to seek a consultation with a breast cancer surgeon and had a mammogram and ultrasound done as part of the investigative process to evaluate her symptoms. This is the essence of my Aunt Kay's radiology report. The conclusion of the radiologist who read the report was that the palpable abnormality in the right breast was demonstrated to be due to a cyst. The breast cancer surgeon that she saw recommended that she should undergo a needle biopsy. I'm not a trained medical professional, but my aunt asked me to help her work out whether her surgeon was recommending the right treatment step. She did not wish to undergo an unnecessary breast biopsy. As I was a younger adult, with access to information on the internet, she thought I could help her do some research on her report. So, as she requested, I did an internet search on breast cysts. This was one of the websites I came across. It stated that breast cysts don't require treatment unless it was large, painful, or uncomfortable. My aunt's cyst was recorded to be 1.2 centimeters in size. Was that considered large? This website did not provide any guidance with respect to what size was considered large. Her lump was not painful, nor did it cause her any physical discomfort. The only discomfort she had was psychological, as she wanted to be sure this was not cancer. Since in general, the websites I encountered all indicated that a cyst was unlikely to be malignant and that breast cysts did not require any treatment, I did have the impression that my aunt's surgeon was recommending an unnecessary biopsy. However, I wanted to dig deeper into my aunt's condition, so I took a look at her ultrasound image, which appeared like this. I thought that there would be images available on the internet which I could compare the appearance of my aunt's finding with. So I looked up this website. I did not understand most of what was said on the website, but I did see that macrocysts can range from 1 to 6 centimeters in diameter. So my aunt's finding was a macrocyst. Did that mean it was large and therefore she should have a biopsy done based on what the previous website said? It was now getting a little confusing. What I did note from this website was this phrase, posterior enhancement. There was an image which showed what this means. So this was the image produced by my aunt's right breast lump. This was the image on the website. Both certainly looked very similar, and my aunt's lump seemed to have posterior enhancement as well. By now, I was really suspicious of my aunt's surgeon. One website from a reputable medical clinic said that breast cysts do not require treatment. Another website, specifically geared toward medical radiology, showed an image of a cyst which looked very similar to the image associated with my aunt's lump. I was almost certain that her surgeon was recommending an unnecessary breast biopsy and told her so. Aunt Kay therefore requested another consultation with her surgeon. I accompanied her for this one. I tried to be respectful to her surgeon for my aunt's sake, even though I thought she was advising my aunt to have an unnecessary medical test. As I said before, my aunt wanted to be absolutely sure that she did not have cancer. To do that, her surgeon said that the only sure way was to remove the whole lump, but medically, she would start with a needle biopsy first. To ensure that it was the most minimally invasive method of testing, she suggested a fine needle biopsy. This would be sort of a compromise to avoid a more invasive procedure if the test showed benign findings. My aunt agreed to it. This was the result of the fine needle biopsy my aunt underwent. The report said that there were carcinoma cells present. Her surgeon said it meant Aunt Kay had breast cancer. That could not be right. I was in shock. I was sure that my internet research was correct, and that my aunt's biopsy was unnecessary. In this case, I had to concede, reluctantly, that I was wrong. I asked the doctor to explain why she advised that my aunt undergo a biopsy. She did so, and recorded her reasons in other videos, the links to which are given in the description below. You may wish to check them out. I searched the internet again to understand the term carcinoma. I found out that the word carcinoma meant cancer, and the two words were used interchangeably. Aunt Kay underwent breast conservation treatment. This was her final pathology report. Surgery proceeded uneventfully, and she was discharged after 1 day. She was referred to a medical oncologist after and underwent chemotherapy. She said chemo was much harder than surgery. After completing chemotherapy, she had radiation treatment to the breast. I am happy to report that all is well after treatment. Those of you who have watched the other explanatory videos would know that the surgeon estimated that Aunt Kay had a 4% chance of having breast cancer based on her clinical condition. This risk of cancer was higher than the 2% threshold for managing the condition conservatively. Conservative management means that the doctor will not advise a biopsy, but review the condition in a few months for any changes. However, her surgeon has seen patients whose condition, initially assessed to be low risk, move from a localized cancer to one that has spread to the lymph nodes in a space of 6 months, so I am glad my aunt decided to have the biopsy, even though I advised her against it. She might have been diagnosed at a more advanced stage of cancer if she had followed my layperson, internet-based advice. After my aunt's cancer diagnosis and treatment, I returned to the internet to find out if any other patient had a similar experience. While not exactly the same, this patient told her story about how doctors initially thought that her breast lump was a cyst. I am more mindful now of why surgeons sometimes have to recommend a biopsy, even if the radiologist misinterprets the imaging findings and reports them as cysts. In 96% of the time, radiologists are correct, and a biopsy would not be necessary. However, my Aunt Kay was among the 4% for whom the biopsy was necessary. A doctor will not know which patient will be among the minority who has cancer with low-risk imaging findings until tissue is removed and examined under a microscope. I learned from my aunt's breast cancer journey that there are times when a biopsy is needed to make an early cancer diagnosis. Talk to your doctor about the pros and cons of having a biopsy. Like my aunt, she had choices, and fortunately for her, she chose the right one. I hope this video clarifies why doctors may recommend biopsy for imaging findings reported to be cysts, and that you have gained confidence for making a decision for yourself should there be a need. I wish you the very best of breast health. Cheers!